All right, today we're going to dry needle for tetanus elbow. Specifically, we're going to dry needle the wrist extensors. A lot of times people have a lot of tightness and increased tone in here, and that causes some of that pain in the tetanus elbow. A lot of times we get it when we're gripping a lot, when we're playing tennis, things like that. So dry needling is really great. It helps decrease some of that tightness, but also increase blood flow, and it talks directly to the muscle. The needles are pretty tiny. I'll show you how tiny some of these needles are. So it's not super scary. And we're gonna start by cleaning off the area. And April's gonna tell me what it feels like to her. Okay, so what we're gonna do is we're gonna feel for an area that's tight on April. April's a physical therapist, so she uses her hands a lot, so she often gets really tight in her forearm. So I'm gonna poke around to where I feel a good spot.
All pretty
tender there, so I'm going to find a good spot. And then I am going to insert the needle. And then how are you feeling?
I don't really feel much right now.
Alright, and then I'm going to go down a little bit. It's just achy in the area. And I'm going to try to get a little bit more of that muscle. Muscles are 3D, so I'm going to rotate a little bit and try to get other areas of that muscle. I'm going to bring it in and out, again, just trying to get different muscle fibers so we get all of that tight trigger point that's bothering her. And then sometimes I'll spin it and I'll just leave it in and let it cook a little bit and try to get it to relax. So sometimes the muscle fibers will wrap around that needle when it's really tight. The longer you keep it in, the more it unwraps and relaxes. So needle's out, rub it a little bit. Sometimes we'll get a little bit of an inflammatory response, which is good. It helps facilitate the healing process. And then, how does it feel afterwards?
Feels okay right now. It's just felt a little achy right now, but pretty much back to normal.
Perfect. It might be a little bit sore afterwards, so she'll heat, just move it around a little bit, make sure to hydrate, just to get rid of some of those toxins, similar if you had a massage. So, all right.